Living with diabetes requires figuring out a maze of guidelines for what to eat, when to check blood sugar, and how to oversee daily health. Many people find that taking vitamins and supplements naturally fits into this process, promising to improve health and provide you control over this ongoing ailment. But what's frequently missed is the complex interaction between these seemingly harmless meds and diabetic drugs. A tango that, if performed incorrectly, can have unforeseen and occasionally harmful consequences. Please let us know whether you value the knowledge and investigation that go into creating a video such as this before we move further. Thank you, and let's get started. It really helps if you click the like and subscribe buttons. Let's look at the top 5 vitamin-drug interactions that can be harmful for diabetics nowadays. Putting the most unexpected exchange last, we will learn the science underlying these interactions and offer practical tips for navigating them safely along the way. Recall that information is power, particularly when it comes to controlling diabetes. The relationship between vitamin B12 and metformin, a key component in the management of type 2 diabetes, comes first on our list. Although one of metformin's less well-known side effects is reduced insulin sensitivity, the medication is well known for its capacity to lower blood sugar. It may reduce the absorption of vitamin B12, which over time may result in a deficit. This is more than a small annoyance. Serious health problems like anemia, nerve damage, and cognitive impairments can result from a B12 shortage. Long-term metformin users can greatly benefit by tracking their B12 levels and taking supplements as needed, according to studies. To prevent any such issues, healthcare professionals should provide guidance on supplementing. Let's move on to talk about vitamin K and how it interacts with anticoagulants, which are frequently given to diabetics to treat their elevated risk of blood clots. Vitamin K is vital for health, but it can mix with drugs like warfarin and cause complications. It is particularly important for blood coagulation. These drugs function by blocking vitamin K's ability to cause blood clots. Consequently, abruptly increasing your vitamin K intake through food or supplements may lessen the medication's effectiveness and increase your risk of blood clots. Maintaining a careful equilibrium necessitates regular observation and contact with healthcare providers. Antioxidants like vitamins E and C, which are well liked by those trying to fight the oxidative stress linked to diabetes, are involved in the third interaction. Nevertheless, these vitamins may interfere with the way insulin and other diabetic treatments work if taken in large amounts, perhaps causing blood sugar levels to fluctuate unexpectedly. Clinical research has indicated the need for prudence, pointing out that although antioxidants help regulate oxidative stress, improper use of them can make glycemic control more difficult. Fourth, we explore the realm of herbal supplements, with a particular emphasis on St. John's wort, which is frequently used for its ability to improve mood. It's a well-liked option for people managing the psychological effects of long-term conditions like diabetes. But St. John's wort can drastically lower the efficacy of a lot of drugs, including diabetes ones. This interaction may cause the liver to increase the metabolism of the medications, resulting in subtherapeutic levels of diabetes medication, running the risk of inadequate glycemic management and several associated issues. This is a powerful reminder to healthcare practitioners that they should talk to you about all supplements, not just traditional vitamins. Ultimately, the most unexpected and risky combination for diabetics is the use of calcium supplements with several diabetes drugs, particularly thiolin-idon. These drugs function by making the body more sensitive to insulin. However, there is evidence to suggest that taking large dosages of calcium supplements may increase the risk of edema or swelling brought on by an excess of fluid in the body's tissues. This interaction is especially concerning since edema can worsen heart failure, a risk that is already increased in people with diabetes, in addition to being uncomfortable. The intricacy of this relationship highlights the significance of holistic diabetes management, in which drugs and nutrients are carefully synchronized to promote general health without unforeseen repercussions. It can be intimidating to navigate the world of vitamin and pharmaceutical interactions, but you can do it with the help of a team of healthcare professionals and expertise. Diabetes sufferers can safely take advantage of both of these advantages. It's imperative to treat supplements with the same prudence as prescription drugs, realizing that safe does not always equate to natural. Effective and safe diabetes control can be achieved by routine examinations, honest discussion with medical professionals, and individualized changes. The most important lesson to be learned from our investigation is the need for careful balance when treating diabetes. Despite their many benefits, vitamins and supplements should be carefully chosen to prevent negative drug interactions. This exploration of the top 5 risky situations emphasizes the significance of making educated decisions and working with healthcare providers. It's critical to consider the larger consequences of these interactions for people with diabetes before we come to an end of our journey. The world of supplements is broad and frequently perceived solely in terms of their possible advantages, ignoring the complications and dangers they may provide when taken in conjunction with prescription drugs. This omission is a call to action for healthcare professionals to have candid, educated conversations with their patients regarding supplement use, in addition to being an issue of personal accountability. Education is essential for enabling people with diabetes to make knowledgeable decisions about their treatment plan. It's about creating a culture of safety and knowledge where choosing any drug or supplement is based on a thorough knowledge of its possible interactions and effects on managing diabetes. The need of tailored care becomes even more apparent as we move across this terrain. The fact that every person reacts differently to vitamins and drugs emphasizes the importance of personalized guidance and close observation. This method guarantees that the advantages of supplements are efficiently utilized, without jeopardizing the intricate equilibrium of managing diabetes. In summary, controlling diabetes is a complex task that involves more than just keeping blood sugar under control. It also involves choosing supplements wisely and avoiding potentially dangerous combinations. By keeping up with current information, consulting healthcare professionals for advice, and using supplements with caution, it is safe for diabetics to travel across these waters, preserving life's quality and optimal health. Recall that information is your most effective weapon for managing diabetes, closely followed by your healthcare team's assistance. By working together, you can develop a thorough strategy that takes care of every part of your health and keeps your diabetes under control rather than allowing it to dominate you. This brings us to the end of this fantastic video about vitamin and medicine combinations for diabetes. Thank you so much for watching this video. Don't forget to like and subscribe to the channel. Also check out the other videos from the Human Body Institute. See you next time.